Welcome back to What's Now. We are going to continue talking about your health, and right now, stem cell transplants. These are life-saving procedures. What do you need to know right now? Well, I spoke with a nurse as well as an individual whose child had a transplant. Let's take a look.
Right now, we are discussing helping patients access life-saving stem cell transplants. And I'm speaking with transplant nurse practitioner Anna Cincotta and Scott MacGregor, a parent of a transplant recipient. And we're going to find out about the match finding process and ways to remove current healthcare barriers. Thank you both for joining us today.
Thanks so much for having us.
Thank you for having us.
So what is the National Marrow Donor Program?
Yeah, the National Marrow Donor Program, also known as Be the Match, for over 30 years has operated the nation's bone marrow registry, which matches patients with blood cancers and blood disorders with the best genetically matched bone marrow donor on the registry through a process called HLA typing.
And then talk about the current barriers that many patients face.
Yeah, unfortunately, there are many, many barriers that patients face to even get to a bone marrow transplant. And in certain diseases and for certain patients, it's their real only chance of cure. And so the NMDP is working to address these barriers, including socioeconomic barriers. We understand patients with ethnically diverse backgrounds can have a much more challenging time finding a donor. But the barrier we really want to focus our time talking about today is that time to transplant, because it's so critical. As a hematology oncology nurse practitioner, I've experienced firsthand seeing how much more challenging it can be for patients that have to relocate for bone marrow transplant because they can't get that process started while they're undergoing their treatment locally to start finding their donor and start that process. And so the NMDP has a program called HLA Today, which provides free typing for patients and family as early as possible in their disease course. So at time of diagnosis or as early as they can, to start identifying their donor, which can take a lot of time and can be more challenging for ethnically diverse patients, as we talked about. Because we understand that getting to transplant as early as possible leads to improved outcomes and overall survival, especially for some aggressive blood cancers like leukemias. So that's one of the ways that the NMDP is really trying to improve access.
Scott, your daughter received a transplant 7 years ago. Can you share your story?
So when my daughter was 7 years old, we learned something that no parent ever wants to hear, and that is that your little girl is very sick and she's in need of a life-saving bone marrow transplant. They did testing within our family. They tested both of my other daughters. They were not a match for Taryn. And sadly, that's true in about 70% of the cases. Oftentimes, you do not find a match within your own family, and that's why the registry is so important. Thankfully, through the National Marrow Donor Program, a matching donor was found, a young man by the name of Ben, who will forever be a life-saving hero to our family because he donated some cells that were a game changer. They saved her life. She's now 15 years old and is completely healthy and well. And, that's the same outcome that we really want for every patient that's searching. And that's why HLA Today is so important. To put it into context, had it been available when my daughter was first diagnosed, we would have known very early on, much sooner, whether there was a match in our family or a match in the registry. And that transplant process could have been an option much earlier. And as has been pointed out, it's so important in terms of improving outcomes in the long run and making sure patients are cured.
Anna, what steps can be taken to increase access to transplants for more patients?
Yeah, so we're looking to Congress to support our HLA Today program and to provide funding for HLA Today so that we can expand the reach of this program so that all patients have this accessible to them and, we can provide equal outcomes for all.
And where can we get more information?
Your viewers could go to bethematch.org. They can click on the advocacy tab to learn more and to stay involved. If you have viewers that are within the ages of 18 to 40, you can go to that website, bethematch.org, and click on the join button. They'll send you a kit in the mail where you could swab the inside of your cheek and find out if you are potentially that life-saving hero that some patient is waiting for. And as was pointed out, a desperate need for diverse donors. So the more diverse donors we get on the registry, the better the chances and the outcomes are for all patients. And finally, you can text HLA to 52886 to contact your congressional representative and tell them to support patients and support this program.
Well, thank you so much, Anna and Scott, for joining us today. I very much appreciate this information about the match finding process and how we can remove current healthcare barriers. Thank you for your time.
Thank you so much.
Thank you.